Welcome everyone, Dr. Mike here, and today we're diving into a crucial topic that affects us all, the top 10 deadliest diseases in the world. Understanding these diseases is not just about statistics, it's about real lives, real stories, and the ongoing battle for health and safety across the globe. From viruses that have shaped human history, to bacteria that continue to challenge modern medicine, each disease on our list comes with its own set of fears, challenges, and solutions. So why should you care? Because knowledge is the first step towards prevention. And in this video, we're not just counting down, we're arming you with information to protect yourself and your loved ones. Let's get started. HIV/AIDS has been a major global health issue since it was first identified in the early 1980s. Originating from a type of chimpanzee in Central Africa, the virus made its way to humans and has since claimed millions of lives. Today, despite advances in medicine, HIV/AIDS remains a leading cause of death worldwide. The impact of HIV/AIDS extends beyond individual health, affecting economies, communities, and entire nations. Current treatments, such as antiretroviral therapy, have transformed HIV from a fatal diagnosis to a manageable chronic condition for many. Yet the disease continues to pose a significant public health challenge. The global response to HIV/AIDS has shown us the importance of international cooperation in disease management, yet there is still much to be done to eliminate this disease completely. Tuberculosis, or TB, has been a known affliction since ancient times, with evidence of its presence found in mummies from 3000 BC. It's caused by a bacterium that primarily affects the lungs but can invade other parts of the body. Despite being preventable and curable, TB remains one of the top killers globally, especially in developing countries. Symptoms like coughing, fever, and weight loss make TB hard to ignore, yet millions suffer undiagnosed. The eradication efforts are complicated by factors such as antibiotic resistance and HIV co-infection, making TB a persistent and deadly foe. The journey towards eradicating TB is fraught with challenges, but with sustained efforts and global cooperation, we can hope to see an end to this disease. Malaria, transmitted through the bites of infected Anopheles mosquitoes, continues to affect millions in tropical and subtropical regions. The disease is both preventable and treatable, yet it remains a significant cause of death among children in Africa. Prevention strategies like mosquito nets and insecticides are crucial, yet access and implementation vary widely. The fight against malaria is a testament to the power of preventive medicine, showcasing how simple tools can make monumental differences. As we push for broader access to preventive measures and effective treatments, the dream of a malaria-free world becomes increasingly attainable. Influenza, or the flu, might seem commonplace, but its impact can be devastating. The virus exhibits high mutation rates, leading to new strains each year, which complicates vaccine formulation and effectiveness. Seasonal epidemics, pandemics, and the resulting complications highlight the flu's potent potential for harm. Public health campaigns focus on vaccination as the primary defense against the flu, emphasizing its role in protecting vulnerable populations. Understanding the flu's mechanisms and staying prepared with annual vaccinations can significantly reduce its health burden. Cholera, a waterborne disease caused by the bacterium Vibrio cholera, leads to severe dehydration and death if untreated. Outbreaks are closely linked to inadequate access to clean water and sanitation facilities. Historically, cholera pandemics have prompted significant advancements in public health infrastructure and water treatment. Today, the fight against cholera involves improving water quality, sanitation, and rapid deployment of oral cholera vaccines during outbreaks. The disease's persistence in the 21st century highlights the ongoing global challenges in water safety and public health. Ebola virus disease, known for its dramatic outbreaks and high mortality rates, first appeared in 1976 in simultaneous outbreaks in Sudan and the Democratic Republic of Congo. Transmitted through direct contact with infected body fluids, the virus leads to severe hemorrhagic fever and often death. Public and global health responses to Ebola emphasize the need for rapid containment, which includes isolation of patients and strict infection control measures. The recent development of an effective vaccine offers hope, highlighting the critical role of medical research in combating such deadly diseases. The outbreak of COVID-19, caused by the novel coronavirus, SARS-CoV-2, has become the defining global health crisis of our time. First identified in Wuhan, China, in December 2019, the virus has spread worldwide, leading to unprecedented public health interventions. The pandemic has highlighted the interconnectedness of our global community, the importance of timely information, and the critical role of healthcare infrastructure. Ongoing research and vaccine development have been pivotal in combating the spread, yet the long-term effects of the pandemic will likely be felt for years to come. Smallpox, once a terrifying and deadly disease, stands as a testament to the success of vaccination. After millennia of devastation, the coordinated global vaccination campaign, led by the World Health Organization, resulted in the eradication of smallpox in 1980. This achievement not only saved millions of lives, but also demonstrated the power of vaccine science and international cooperation. The story of smallpox offers hope and a blueprint for the eradication of other infectious diseases through persistent public health efforts and innovations. Measles is one of the most infectious diseases known to man, yet it is entirely preventable through vaccination. Characterized by high fever, rash, and severe respiratory symptoms, measles can lead to serious complications, particularly in young children. Despite the availability of a safe and effective vaccine, outbreaks continue to occur, often fueled by vaccine hesitancy and gaps in immunization coverage. Strengthening public health messaging and ensuring widespread vaccination are essential to control and eventually eliminate measles. Dengue fever, transmitted by Aedes mosquitoes, has seen a dramatic increase in cases worldwide. Characterized by high fever, severe headache, and joint pain, dengue can progress to more severe forms, leading to significant morbidity and mortality. Effective vector control and community engagement are key in preventing dengue outbreaks. As climate change expands the habitats of Aedes mosquitoes, the risk of dengue increases, making it a pressing health concern in the face of global warming. As we conclude our journey through the top 10 deadliest diseases, it's clear that the battle against infectious diseases is far from over. However, armed with knowledge and the right tools, we can take proactive steps to protect ourselves and our communities. Remember, prevention is always better than cure. Stay informed about vaccinations, practice good hygiene, and support public health initiatives in your area. Together we can make a difference in the global fight against these deadly diseases. Thank you for joining me today, and remember, stay healthy and stay alert. Pause 2S. As we reflect on the deadliest diseases and the challenges they pose, it's important to recognize the incredible strides being made in medical research and development. Every day, scientists and healthcare professionals around the world are working tirelessly to find new treatments and develop innovative vaccines. Pause 1S. Recently, we've seen remarkable advancements such as mRNA vaccines, which have revolutionized the way we approach immunization. Additionally, advances in genetic research are paving the way for personalized medicine, allowing treatments to be tailored to individual patients. Pause 1S. The future holds even more promise with AI-driven diagnostics and cutting-edge therapies like CRISPR gene editing. These innovations are becoming realities thanks to the relentless efforts of the scientific community. Pause 1S. By investing in science and education, we can ensure future generations have the tools to combat even the deadliest diseases. Stay inspired, stay hopeful, and most importantly, stay healthy.